Hello, this is Shalonda Houston. This is going to be my video presentation because I have been having issues trying to do a PowerPoint, so I'm just going to do a video. And I'm going over psychology, and I'm going over the OCD, which is also known as obsessive compulsive disorder, which is my midterm project. Okay, so with obsessive compulsive disorder, which is also known as OCD, most people just call it OCD. It's a mental health disorder characterized by repetitive actions that seem impossible to stop, like constantly squinching your nose. Some people constantly have to turn the doorknob. People have like these little small tics, like tapping their little fingers. Ooh, the pin pushes. The pin pushes. Ooh, people like to press them little pins. That's my pet peeve. I do not like pins being pushed like that. Drives me insane. But I know my little ticks. I like to go like this a lot sometimes, and I really talk with my hands. I have to talk with my hands. If I don't talk with my hands, I feel like I'm going cuckoo. So it's actually very common in the U.S. More than 3 million cases per year, typically. With the treatment for OCD, you have to get a medical profession. You have to get like a doctor or you pretty much have to get a doctor to tell you that you have OCD. You got to go through all these tests and get the treatment that way. Best, it depends on its individual, depending on how severe it is. If it's I know if it's severe, well, it depends on the level, but for that, as far as the treatment, oftentimes it does require lab tests or imaging. Um, it can actually last up to several years or just lifelong. It just might last your whole life. I'm definitely OCD. It's toned down. I remember back in middle school, I was extremely OCD to the point where I had my closet color coordinated by season. So it was pretty bad. Right now, I'm more OCD when it comes to placement. Like I know where everything is in a certain spot, and when it's moved, I automatically know, and I get really frustrated with that. It's common around the ages of 18 to 35. So young people and well, middle, not even middle age, just those young folks, 18 to 35. So with the family history, it may increase the likelihood. Um, it's not always common when it comes to genetics. Urgent medical attention is strongly recommended depending on how severe it is. So that's just an overview. Now, with the symptoms with OCD, you can either be, it can be obsessions or it can be compulsions. Obsessions, how do I describe obsessions? So with obsessions, obsessions is you constantly keep thinking about the same thing. Compulsions, you act on the obsession. So let's say that you really like counting to 10 every day. You really like counting to 10. With your compulsion, it comes in, if it's both, you you might go a little cuckoo if you don't specifically count to 10. You feel like something's bad going to happen. For me, I know I have really bad anxiety when it comes to odd numbers. I don't know why, it's always been that way. But if I do not make sure the volume, or I eat by twos, everything is even. I eat by twos. My volume on the has to be on an even number. I can't have it on an odd number. Like, I hate odd numbers. Even though I was born on July, which is the number 7, and I was born on the 17th, 1994, which is an even number, I always have I always have a reason for why I was still born on an odd number and odd birthday. Like it's still, I'll still find an even number out of it. So if you add it all together or divide all the other stuff, I'll always find an even number either way. Continuing with that. So symptoms can actually be mild and gradually progress in severity. So it could range from mild, which is like just a little light symptoms, like a little, oh, okay, gotta make sure this is okay and walk out the door, to severe where you have to have it a certain way before you walk out the door, or something bad's gonna happen and your anxiety just gets really bad and you can't work and all that other stuff. So stress actually is a main factor that worsens the symptoms. So another symptom, you can be very persistent, again, repetitive, and you have unwanted thoughts. Like these unwanted thoughts, like these bad thoughts that you have. Like with me, odd numbers make me freak out. It's bad. The tree is gonna fall. Like somebody's gonna die. So mine is pretty bad with the anxiety. So I just try to stay with even numbers as much as possible. You have urges or images that are intrusive. Every now and again, I'll have a bad image and it'll be stuck with me for like a week or two. So I understand that. Compulsive or ritualistic behavior to get rid of thoughts. So some people like to get rid of the bad thoughts. They start thinking about something good to balance out the negative thoughts that they have in their head, or rituals where they have to count to 10 before they walk out the door, and they got to turn the doorknob 3 times before they lock it, and they got to unlock it and relock it and stuff. So those are some of the symptoms. The causes. So with the causes, there actually isn't a complete understanding of the causes of OCD. It can be associated with the changes in chemistry or functioning of the brain, family history, environmental factors such as certain infections that are triggered by your OCD, infections such as strep throat. Like that can also contribute. Stressful events in your life. People dying, people giving birth, people moving on, breaks ups, and all this other stuff. So those are stressful events. You're getting a new job, losing a new job, or losing an old job, losing a car. Those are some stressful things in life. Other mental illnesses such as depression or anxiety can also cause OCD. I definitely do. I've been suffering from depression for about 7 years now, and it's not easy, especially after having kids. It gets worse, I feel like, but that's just my opinion. So going through, we're going to talk about the preventions. So with OCD, the preventions that you can do, you need to learn about the condition. Really educate yourself about OCD. Then you can take your medication if it's prescribed to you at the right time. Never take it at the wrong time, like when you're driving. If it makes you drowsy, don't take it when you're driving. Just common sense. Complete your medication without stopping them halfway through, because it definitely mess up your mind, your body, and all this other stuff. So just try to make sure you take it all completely without stopping, like a birth control pill, but don't think it that way, but sort of think it that way as far as the schedule point. Learn to identify the warning signs. Definitely. That's why you got to do your research. Know the warning signs. That way you can identify the warning signs and the symptoms, just in case if it's not you and it's somebody else. Join a support group. I love groups. Support groups are always helpful. Find a support group that actually you feel that can benefit you, especially somebody who's been in your shoes. So if you have OCD and you have depression, or you have OCD and you have really bad anxiety, find a group that complements both, so that way they understand you completely. Well, they have a better understanding of you. Because if they just have OCD and they don't have depression, they don't get you 100%. I love this. I love this thing so much. Remain socially active. Try to make sure that you're socially involved with just even if it's one friend. Just try to make sure that you're talking to human beings every now and again. It don't have to be every day, but every now and again, do a health make sure you do a mental health check with somebody else. Hey, how you doing? I just wanted to say hi. How you doing? That way, that you can still be sociable. Also, number one thing: always talk to your doctor regarding any side effects of any medication. So that was pretty much my summarization of OCD. So that was with the symptoms and the causes. I'm going to go quickly into the diagnostic, and then I'll just go over the treatment real quick. So with the diagnostic, the doctor may ask you questions to assess like the different thoughts and feelings that you go through, common tests and procedures. They normally do like a psychological exam. They talk to you about family members and your thoughts, your feelings, symptoms, and behavior, just to get a feel of where you are. And they also might do a blood test to evaluate the total blood count, your blood cell count, your thyroid problems, or alcohol or drug abuse. That could also be a factor as well. Now with treatment, there's different kinds of treatment. Like I said, the medication has to be prescribed to reduce the symptoms. You can also do therapy. There's psychotherapy, which is a cognitive behavioral therapy, which really helps the patient to control the symptoms. So like exposure and response prevention exposes the patient to feared objects. So pretty much put that person around something that they are scared of, or that those bad thoughts. Like if I see odd numbers, I freak out. So I would probably be tested around a lot of odd numbers, and to see like how would I react to that. Self-care, number one thing. Self-care. Eat healthy food. So eat a nutrition diet. Not a diet. Eat nutritious food. Take rest. Make sure you get some rest. Always talk to a doctor before taking any medication. Exercise rarely to manage your stress. With nutrition, dairy products it's best to eat dairy products with low fat content, with like yogurt and milk. Foods that have a high dose of antioxidants. I really hate that word because I always say it wrong. Food that are rich in omega-3 fatty acids like walnuts, fish, flax seeds. Foods to avoid to help with the OCD. Avoid food with high sugar, soda, candy, sweets, brownies. Like, just stay away from it. Foods with caffeine, coffee. Sadly, green tea has a lot of caffeine, and chocolate. Alcohol beverages don't really help with it either. So avoid alcohol beverages. Just so you can just try to maintain some type of healthy, not saying that you cut it completely out of your diet, but just in moderation. Let's say that. Processed food like soup is really processed. Frozen dinners and fast food. But if your symptoms are extremely severe, please talk to a psychiatrist. If you're concerned about the diagnostics or the treatment of your mental illness, a psychologist. If you need to see a psychologist, you could do that as well, to just study the behavior that's related to your mental illness as well. But that's pretty much my presentation of, sorry it had to be 15 minutes long. Wanted to make sure I cover it as much as things as possible. But I just went over the symptoms, the causes, the diagnosis, the treatments, the preventative measure. So that's pretty much my presentation. Thank you so much, Miss Brown. You have a great night, ma'am. Hopefully I get that 100%. If not, it's okay. I'm happy to just pass. I'm happy to pass. But this is really fun. It makes me really think about my OCD. I'm definitely going to go talk to somebody again. Bye.